Hello, my name is Sarah. I'll be your student nurse today.
Hello.
Can I get your name and date of birth?
Jane Doe, February 11th, 1960.
Okay, do you have any allergies?
No.
No. Okay, I was looking over your chart and the doctor has put in an order for an NG tube to be placed.
Okay.
Have you ever had one?
I don't think so.
Okay. Pretty much, it's a tube that's gonna go down in your mouth, down your esophagus, and into your process or your stomach. And it's used to also give you your medicines, but also to kind of relieve some of that nausea as it may come um, from like your stomach acids and stuff. It keeps those off to keep the nausea and stuff down.
Okay.
Okay, so I'm just gonna lift you to a comfortable position here. Okay. I'm going to look real quick in your mouth and see if there's any lesions or any sores or anything like that.
Yeah, because I like being a
And
reporter. I
in
like
your
working.
nostrils for any lesions or sores. Okay. Do you have you ever had any surgeries, facial surgeries, any nosebleeds, history of nose pulps or anything like that?
I have not.
Okay. Well, I'm going to get my gloves on real quick. And I'm going to plug off one nostril and have you blow out one side and the other side. Okay. Which nostril do you breathe out better?
The right one.
Okay. Well, I'm going to be placing this in the right. But first here, I'm going to assess your abdomen real quick for any distension. Okay. I do not see no distension. I'm going to listen for bowel sounds.
It seems
Okay.
it's kind of self. If we deposit what I need before. Okay, so he doesn't need this. He'll start.
I hear normal active bowel sounds. Now I'm going to palpate.
You're moving it.
Does this hurt anywhere?
No.
Okay. Good deal.
All right, what's your,
I'm going to put this towel over you.
4 millimeter.
And give you this basin. Sit you a little bit there.
when you measure his nares,
This basin's here just in case you feel like you're going to get sew up.
say,
Okay.
like, it's like 53, but then only put the tape on like 30, because you cannot get it.
I'm dipping this in water because it's a mannequin. If it was in real life, I would use some lubricant.
He's got like, he's had,
But first, I'm going to wipe that off because I actually need to
I
measure
got my little list.
from your nose, around your ear,
Yeah. And here's my little scene.
and down to the xiphoid process, the stomach area.
in the video, send that in.
Okay, yeah, because I forgot my stuff.
Don't forget. All right, ready?
Yes, I'm going.
I'm ready. Wait, no, stop. Okay, now go.
About there you go. And it's at 57.
Today. Can I get your name and date of birth?
John Smith, 10/27/70.
I would mark the 57 mark at this
No
point.
allergies.
Okay. So, Mr. John
Now
Smith,
I would
today
dip
we're
it
gonna
in
give you
water.
an NG tube that is going through your mouth, through your esophagus to your stomach.
Put in some water.
Give you your nutrients.
Like I said earlier, if it was on real life, I would use some lubricant.
So I checked your orders. You had your
What I want you to do is breathe in real deep. Now let it out. Good job. Now I'm going to swallow, swallow, swallow. Good job. Good job. Keep going. Swallow, swallow, swallow.
Do you have any questions for me?
Squeeze out just a little. Okay. With it being a mannequin, I can push back on him.
Are you asking what your position? Go assess this mouth.
Okay, I'm gonna ease it back out.
Listen to your bell sounds.
I do not think I got it in. In.
There's X sounds like quadrants of its stomach.
We need to call a physician later to see what he wants to do.
You should want the left.
Okay, so I'm gonna go ahead and look at your stomach.
Wait.
Maybe there's not one in here.
And fix that.
I feel like I'm a mess right now.
You're doing fine. You're doing real good.
I'm gonna start here.
A little bit more. Okay. And then this good.
I'm gonna lay this down here. Anytime this is so comfortable.
And I would also document the fluid intake and the type and the size of the tube that I use. And then, the patient rated the procedure well. And then I'm going to go ahead and here's your call light. And bedside table. If you need anything, let me know, okay? Are you comfortable in your position right now? Yes, okay. And also I forgot, before I start, I start, putting that tube.
Normally we would use order-based leaders, but it doesn't say we did it in this.
The procedure
Okay.
is,
So we're gonna
very
do the left
uncomfortable,
side.
but it shouldn't be painful.
Just
And
keep
you
breathing
let me
through
know
your mouth.
For a
if you
moment.
wanted to take a break.
So I can check placement.
And also.
And you would check placement by
You're doing good.
listening to the lungs. If it was not in the right place, if it was in the lung, you would hear obstruction. He would be coughing, a lot of gasping, stuff like that. You would also call and have X-ray come up and do an X-ray to make sure that there is the correct placement. At this time, I'm going to check for residual.
Wait till the patient recovers or wait till their normal breathing resumes. Okay? All right. Thank you for letting me take care of you today.
I'm getting about 30 milliliters of residual. I'm going to slowly put that back in.
All the way to the ground.
The liquid that I just brought out is actually enzymes that holds electrolytes and stuff that is he does not need to lose.
I know.
Okay.
I really even know that we all had trouble getting it to.
And now
This is what we're doing.
Some of the dummies.
I will demonstrate on his feeding. I'm giving his medicines.
But this is too.
And on the residual, if it was over 200, we would not
No, you just have to check.
we would not be given meds. We would hold the meds and contact the doctor. At this point, on giving meds,
So,
you would clamp this to keep air from getting in.
listen to the breath
You would
sounds in the front of the
flush
bag, check for
with
gastric
30 milliliters
juices,
of
and
water.
then assess.
Where do you want me?
So
If
we're
they're-
checking for residual and listening to the breath sounds, that just says that's the proper place.
And then clamp it before it empties all the way out to keep air from coming back in. You would take
So
your
I put like
medicine
obvious
and you would dump
stress,
it
respiratory
in
stress, like
and let it
coughing,
go.
gagging, that I would remove it.
And then clamp it back off and flush again with 30 milliliters of water.
Now that that place, the NG2, we're gonna check for
Let it
places.
flush.
We're gonna listen to their
Clamp
beat.
again to avoid air getting in. And since I've just flushed, I could also do the Embola speed. You would dump it. You'd hold it up like this. Clamp it back off when it was
There
done.
no respiratory distress, their readings equal to our
Flush again
Now we're gonna check
with
for
30
residual
milliliters
vascular
water.
and check for proper placement. If it happens to be in the wrong placement, we would remove and call the doctor.
And then I would clamp it for 30 minutes before hooking it up to suction.
And so
Okay, it's
now,
been
we're
30
gonna put in
minutes.
order for an X-ray, we'll be here. And
You
we'll
would hook it up to suction after 30. This. And you would turn it to intermediate. You would set it anywhere between 40 to 60, no more than 80.
Okay, I'm back, I need to,
And if the tubing ever got clogged, you could
all that. I said, okay, Mr. Smith. I'd
turn
like
it
to give
on
you your
high for
tube.
just
I have orders to give you your tube.
a little bit, not very long, to see if that would break up the clog, the blockage of it. But you would stay in the room, don't
You do, you
leave,
got plenty of time.
and then you would set it back to the normal setting of 40 to 60. Okay.
She wants to start me knocking from back in.
Alright.
Just put the bed down like an inch or two and then just say, okay, we're
For the removal of the NG2,
All right,
Stressing.
I would
all right.
make sure
Go
it's
out,
out of
come back in.
section.
You don't have to come back in, just come around and say, hey, Mr. Smith.
Mr. Smith, X-ray, diction pain,
Okay.
replacement, and I now have orders to
I
give you
would start by
your tube, okay?
taking the tape off.
He needs to take that away.
Well, I would actually tell my patient what I'm fixing to do first. The orders has come in to now remove your NG tube. I've set your towel and basin right back here, just in case you
I need
need
that
it.
when I remove it.
Here in a minute, I'll have you take a deep breath and blow out.
Ready?
What do you mean?
As I'm
Take
taking
start
this
video
tape
again.
off.
You don't have to start that, you can just flip it.
Okay.
Ready?
Okay. Deep breath in and blow out. Good, good, good. Breathe, 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 breathe. Good job. And now it's out. I would wipe this off like so. Gather this up.
What to do first if we want to check for residual?
And then I would actually throw this away. And then I would check on my patient, make sure he's okay.
So a 30 milliliter, we would measure this.
I would lower him back down. Make sure he's in a comfortable position. Ask him if there was anything I could get for him. Make sure his call light was in reach. Is there anything I can get for you right now?
No, I'm good, thank you.
Okay. Well, here's your call light. If you need me for anything, do not hesitate to call.
Okay.
All right. Are you comfortable in this position?
Yeah, I'm good.
Okay. Now with hand hygiene.
I'm so confused. I just want to start all the way over.
And that's it.